Hello, friends. This is Dr. Anish Vaknalli. I'm a homeopath practicing for the past 25 years. I specialize in children developmental and behavioral conditions such as autism, ADHD, behavioral problems such as ODD, which is oppositional defiant disorder, other problems such as epilepsy, etc. Okay. Today, let's talk about what therapies are available for autism and what are its benefits, advantages, and what you can do in order to complement those therapies. Okay. So the first therapy is known as play therapy. Play therapy is nothing but playing with your child. And the reason why play therapy is needed is because the child lacks joint attention. Joint attention means where the child is able to engage with you meaningfully. Autistic children do not engage with you. Okay, they are very indifferent, they are aloof, they stay in their own world. Even if you call them or you give some command or you try to interact with them, they do not give you any attention. So how do you achieve this? How do you get their attention? How do you make them interact with you? And the simplest way is play therapy. In play therapy, what you do is, say, for example, the child is busy playing with a particular toy or some object, or maybe a paper and some crayon or a pencil or whatever it may be. What you do is you get engaged in the same activity as what the child is doing. Okay. So, for example, if a child is playing with a car, for example. So you also go and get involved, try to play with the child with that car, explain to the child the tires of the car, for example. You can show the door of the car, the color of the car, things like that. Okay, so it's nothing other than playing with your child, interacting with the child, developing a bond with the child, so that the child starts communicating, interacting with you, and increasing their joint attention. So that's called play therapy. The second therapy is called occupational therapy. Occupational therapy is the first thing usually everybody goes for. That's the basic therapy which is available and comes. We normally say, you first do play therapy at home, create that bond. Simultaneously, you start with occupational therapy, which is nothing but teaching the child day to day simple survival activities like buttoning up the clothes, putting on clothes, folding of clothes. It can involve, things which the child needs on a day to day basis at home, for example, like putting things in a glass, using a spoon, as well as certain activities which will help the child play in a, say, like in the garden, for example, like climbing, jumping, all those kinds of things. So, occupational therapy is nothing other than things which the child would need to learn in order to survive on a day to day basis. Okay, so that is occupational therapy. Third is something uh, which is required, but is required after the child settles down a little bit and responds to you. That therapy is called speech therapy. Speech therapy can only be started once the child sits, focuses, there is joint attention, there is some interaction. If you send the child for speech therapy before the child even achieves this, the child is going to go there, won't sit, will be just roaming around, and you'll be just wasting your time and money. So, do not do speech therapy unless the child has some level of joint attention, some level of focus, some level of command following, and where the child at least understands basic things so that he can start learning the names or words of things which are basically required for his day to day survival. So, speech therapy is a wonderful thing. Uh, However, when the child starts interacting and there's joint attention, remember in speech therapy, you should also know that it is not just teaching the child but single words and things like that. It is also teaching with the help of visual aids. Sometimes they also use certain apps for this, like overseas a lot of apps are used where the child learns to speak from these apps. But be careful, because if you at home start doing this, the child will be addicted to whatever gadget you give. Screen time will increase. It'll be very difficult for you to get over these things. So make sure whatever you do with the consent of the therapist. Another thing you should remember is that whatever the therapist does in speech therapy, you should follow the same thing at home as well, because you should coordinate with the speech therapist and follow it at home so that the child at least learns basic commands and even learns to say those particular words. Okay, so that is speech therapy. The next is something called ABA therapy, which is the best, but sadly, it is not really widely available in India because not there aren't so many that are completely qualified for ABA. Now, ABA therapy is applied behavioral analysis, in which you teach the child by reinforcing and, in a way, rewarding the child for what the child has done. Okay, so it's a way to kind of improve the ability of the child's understanding at the same time that something that the child does is correct, and you reward the child or reinforce the child. So that is called ABA therapy. Um, so this is, a simple outline of the therapies available in order that you can follow: play therapy, occupational therapy, speech, and last is ABA. Now, I would like to describe to you about our experience with therapies in India and what its advantages and disadvantages are, and what you need to do in order to make sure that these therapies work to its optimum. Okay. Uh, the first is whether only therapies are sufficient and whether therapies and medicines need to be done simultaneously. You have to do medicines, you have to give some form of medicine for children with autism. However, do note that overseas nobody uses medicines because they only rely on therapies. Okay. However, if they knew more about homeopathy, I'm pretty sure they would, suggest homeopathy with the therapies. They do not use any allopathic medicines overseas, okay, as far as I've seen. Maybe in extreme cases, but not in all cases. In India, however, they use a lot of allopathic medicines to reduce hyperactivity, to increase focus, and things like that, which are not done overseas. So we are a little surprised why it is done so, commonly over here with most kids having autism. So that's the first thing you should know. Second, so then what medicines can you give? The first choice we would recommend is homeopathy because it has no side effects, and it can be taken as long as you want to take it. It's not going to cause any kind of even drug interaction. So even if you have to give homeopathy with allopathy, you're absolutely fine. You can do that. Homeopathy with Ayurveda, absolutely fine. No problem at all. So whether medicines are required, yes, it is required. First option would be homeopathy. Allopathy, we do not recommend. However, in extreme cases where even after giving homeopathy, the child is not sitting or is super violent, for example, or there are a lot of issues which are out of hand and nothing is working on the child, yes, then maybe allopathic medicines can be used. Otherwise, first line of treatment would be homeopathy along with your therapies. Second point I would like to make and bring to your attention is what is the quality of therapies that are being used in India? See, you need to know that the therapist you are going to is the qualified one. However, the cases are so many and the therapists are so few that the therapist who has actually learned ABA or is a qualified person employs other people who are not qualified. They are only instructed to work with your child. So there is no goal plan. There's nothing that has been, planned out for your child where, like within a month this has to be achieved or within 6 months this has to be achieved. I don't see that happening compared to what happens overseas. Okay, so I would say you better be careful what the therapist is doing, who is doing these therapies with your child, and whether they have some kind of a plan. Okay, do not just blindly let them do those therapies, and do not, just don't question them. You need to question them, and you need to also learn from them what you should simultaneously do things at home so that you can complement those particular therapies. Okay, a lot of therapists will say don't do anything at home, leave it up to us, but then leaving it up to them, who are you leaving it up to? So just be a little aware of these things. Okay, so as far as the quality is concerned, I would suggest definitely be on guard and question the therapist and figure out what is happening. The third point is whether your child should go to playgroup and school. Now, it all depends from case to case. Okay, not all children are capable of going to school. Playgroups, probably everybody could, all autistic kids could, but definitely it depends on the ability. The reason being is that if your child does not sit in one place, if your child is constantly running around, or is probably, some kids can be a little aggressive. So things like that, you need to kind of take a call on that, whether your child will adapt to that situation or not. Secondly, we recommend playgroup definitely, because it is still where the teachers can manage the child, but ensure that it's a small playgroup. There are less number of kids. The sometimes they have the caretaker, like the ayah and somebody like that, helping your child as well, and keeping attention on your child. So as far as playgroup is concerned, it should not be a problem. You can definitely put your child. But as far as schooling is concerned, try to have a school which where there is a shadow teacher, for example, where there's a special teacher kept for your child, who's teaching your child simultaneously, or you do, or your child sits in the class and is not roaming around. Then schooling is fine. There are a lot of inclusive schools nowadays where they have normal curriculum, or they have a little adapted curriculum for your child, based on the child's abilities, and there are special educator teachers and things like that, which happen in these inclusive schools. So if you have that option, definitely you could think about it. Okay. The fourth point I would like to make is, what is the environment you should have at your house, while these therapies are going on. You know what? It's very unusual that people talk in a number of languages at home in India, right? It's not very unusual, sorry. So what happens is, you need to make sure that the child is spoken to in one language. Do not make long sentences like, XYZ, please come here. No, just come, go, sit. Try to use single words. Try to use a word and try to use the same, hand, like, gesture. Like, give some kind of an indication that word means a particular thing. This should also coordinate with what's happening at your therapy center. Okay. Also, the language you use at home and the commands you're using at home should be the same as that the therapist is using in the center. Okay. So it's very important that you coordinate these things with your, with the therapy center, so that the same thing can be achieved faster. Also remember that everybody at home should follow the same thing. Like, if one person is following what the therapist has said but the others are not, then it does not make sense. So try to have one particular routine, one language, simple commands, single commands, and keeping the child occupied is very important. Do not allow screen time at home. It is something that is, every person who's into developmental children will always tell you, do not have screen time, so please stop it. And overall, if you kind of coordinate things with your therapist, it should be pretty easy. Okay. So this is a brief summary of therapies, and I'm pretty sure by following this, you should be able to make a difference to your child. We as homeopaths treat children with developmental issues, so, and we find excellent results. Okay, so please start homeopathy as a first line of treatment along with any therapy that you do. Okay, so all the best, and if you have any questions, please write to us or call us. Bye bye.